How much do you know about male thrush? What is male thrush? How can you get male thrush? What are the symptoms? What can I use to treat male thrush? Where on the body does thrush affect?
Thrush is a fungal infection and is caused by a yeast-like fungus called Candida albicans. Candida albicans naturally resides on our skin, but under certain circumstances or if triggered, it can multiply and overgrow. It normally resides in areas of our skin of our body that are moist, for example, our genital areas or the mouth or the actual skin. For men, thrush affects mainly the head of the penis or the foreskin, and an inflammation of the head of the penis is commonly called balanitis. Also, men can get oral thrush, which affects the mucous membranes in the mouth. Very often, men do not get symptoms of thrush, but that doesn't mean that the infection is not there. So if men get symptoms of thrush, they need to look out for burning sensation, irritation, or itchiness under the foreskin or on the tip of the penis. Or they need to look out for swelling or inflammation, also redness or red patches, especially under the foreskin. They can also experience discharge, which is white, thick, and lumpy, and very often it can be associated with bad odor. And they might experience difficulty in pulling back the foreskin. Like we said, Candida naturally resides on our skin, but under certain circumstances, it can be triggered to overgrow or multiply, leading to thrush. Some of the factors that can trigger thrush are antibiotics. If you have diabetes, if your immune system is low, for example, because you have underlying medical condition, or you take medication that can weaken your immune system. Poor hygiene, especially in men that are not circumcised. Skin conditions such as broken skin, damaged skin, or eczema that can also lead to thrush and inflammation. Also, tight foreskin, it makes it really difficult to clean the area under the foreskin or in the folds, and that can lead to inflammation as well. And also products that you may use, bath foams, soaps, gels, lubricant. Some of these products can actually inflame or irritate the head of the penis or the foreskin, therefore they can trigger the inflammation. Thrush is not classified as a sexually transmitted infection, so if you have symptoms but your partner does not have symptoms, they do not need to get treatment or be informed. But said that, there is a small percentage, a small possibility that it can actually be passed during sex, so you might want to avoid sex until it cleared up completely, or you might want to use protections. Also, it's very important to say that some of the symptoms of thrush can be similar to STIs, for example, chlamydia. So if you experience any abdominal pain or difficulty in urinating, or if you have any blisters like patches on the foreskin or on the tip of the penis, it's very, very important that you get checked by a GP or a doctor. So luckily for you, at Medino, we have over-the-counter remedies, medications that you can use to treat symptoms of thrush. You can use creams that you can apply on the head of the penis or under the foreskin or both. These creams normally contain clotrimazole, 2% or 1%, which is an antifungal agent. Also, we have over-the-counter oral tablets containing fluconazole. And the treatment normally lasts a week time. So for the creams, you will need to apply for every day for a week. And the tablet, you will only need to take it once. And if symptoms last more than a week, then the pharmacist is gonna recommend you, refer you to the doctor.